Polio is a disease that can be traced all the way back to ancient Egypt. It's highly contagious, and though we now have two types of vaccines to protect us against the virus, they were created fairly recently. Polio swept through America in 1916, and according to best-selling author Lynn Cullen, it was greatly feared for decades.
They did have nuclear war before that. Hot war, World War II, were even more so on people's minds. But just below that was the simmering fear of polio, which was devastating in the fact that it claimed children, babies, children, young adults. They didn't know how it worked, and they didn't have anything against it. All they had was, much like us in the beginning of COVID, they told people to wash their hands. They told them not to go swimming.
Isolation was another similarity between polio and the 2020 pandemic. And though placing infected people into quarantine would help stop the spread, it only worked if people isolated in the beginning stages of their infection. A main problem with this is that 95% of people had either minor symptoms or none at all, making it difficult to catch early on.
This was not an easy disease. It killed people, but more often it left them paralyzed. And when they were in the acute infection stage, it was very painful. It could be painful in their limbs for a lot of people. And in fact, some people were paralyzed to the point where they couldn't breathe, that their chest muscles were involved. They were put in these iron lungs that we've all heard about, and they were every bit as scary as they looked.
The iron lung was developed in 1928. It was a tube-shaped respirator that almost entirely covered a person's body. A motor pump changed the pressure inside to push air in and out of the patient's lungs. Many people spent a week or two inside this machine until they could breathe on their own.
I could go on, about the pain that the children suffered in their limbs and the horrible treatment of it for a long time. They would take these children with their very sore limbs, screaming pain in their limbs, and they would put them in casts or put them in really tight braces, thinking, well, this will keep the leg from withering. So it was just the treatment, and the lack of knowledge just scared the tar out of everybody.
Cullen says there quickly became a race to find the cure. Doctors Albert Sabin and Jonas Salk were leading the research, but both faced the same hurdle. No one knew how polio traveled through the body. The prevailing theory was that the virus entered through the nose and went straight to the nervous system. However, Dr. Dorothy Horstmann, an epidemiologist, didn't share this belief.
And in fact, in the early 40s, she had found in these blood samples that she took when she would go on the polio study unit, she found in one of these samples of patients the virus in the blood. And she was like, that's where it is. But she couldn't find it again. And she tried and she tried. And her colleagues are like, it's not there. Just give it up.
Cullen's new book, The Woman with the Cure, highlights Horstmann's career as one of the few women in the medical field at the time. Even as her colleagues discredited her work, Horstmann was convinced she had the right idea.
All the knowledge was against her for believing this theory, but she persisted. And by golly, she did find that the virus was in the blood. In fact, what happened is people were looking too late. They were looking at people with polio, with symptoms, I should say. And no, the virus appeared in the blood before there were symptoms.
And this wasn't the first time Horstmann had been underestimated. In fact, Cullen says her whole career was an uphill battle to prove she belonged in the medical community. She entered college as an English major, but after a hospital visit with a family friend, Horstmann changed her studies to medicine.
When she tried to get her residency, nobody would take her. And then at the last moment, Vanderbilt, who had already rejected her, said, yes, come. Well, it turns out that the chief of medicine who was hiring saw on this fantastic resume, it was the initials D.M. Horstmann. And he's like, this DM is great. And he had her come in. And I guess she loved telling the tale of how he just nearly healed when Dorothy Millicent Horstmann came in. And he was kind of forced into, because of the late date, having her get this job.
This was in the 1940s when women made up around just 5% of all doctors in the United States. Even with the odds stacked against her, Horstmann completed her residency and was hired at Yale University. It was there where she made the discovery that Cullen says was the foundation for the long-anticipated polio vaccine. Once Horstmann found that the virus traveled through the blood, Sabin and Salk were able to accurately target the infection.
She'd been working on this for about 9 years, and in the last couple of years, another scientist, David Bodian, felt that, yes, I think polio is in the blood too, and he found it independently. So their results came out, they verified each other's results, and their results came out together.
So when it was time to present the findings, Horstmann and Bodian made the announcement together. Cullen says that some of the discrimination lessened after Horstmann's discovery, but her career progressed much slower than her colleagues.
She worked at Yale for more than a decade, pushing 2 decades. And it was only after that discovery that they made her a full professor in the medical school. Her colleagues had already long before who'd started with her gotten their full professorships. It just took her longer to do everything. And it wasn't that her work wasn't brilliant. She was the one that the WHO, toward the middle of her career in 1959, asked to go evaluate the vaccine trial for the oral polio vaccine in Russia. This is the world's largest drug trial to this day. And they asked her, because the USSR would only allow one Western scientist. This is during the Cold War. And they said, okay, we'll have one scientist. And who did the WHO choose? Dorothy.
With Horstmann's independent review of the trials, the oral vaccine was approved for use by the World Health Organization.
And the result of that is all of us who have received an oral polio vaccine. I did as a sugar cube. You probably heard about the kids who got the sugar cubes in school in the 60s. We got them on Dorothy Horstmann's say-so. I like to think that there's this tie, to all of us who have gotten the oral polio vaccine.
Though the first vaccine was given as a sugar cube to school children, the U.S. has only used an inactivated polio vaccine shot since 2000. And while there's still no cure for the virus, the World Health Organization reports that polio cases have decreased by more than 99% since 1988. The virus that kept Americans living in fear for decades has been almost entirely eradicated because of the work of brilliant researchers in the 1950s. The Woman with the Cure is available now wherever books are sold. You can find more information about Lynn Cullen and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Twitter, and Instagram. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Nancy Benson. This segment is brought to you by the Capital One Venture X Card. Earn 10X miles on hotels and rental cars and 5X miles on flights when you book through Capital One Travel, plus 2X miles on all other purchases. Capital One, what's in your wallet? Terms apply. See CapitalOne.com for details. Coming up next week on Radio Health Journal.
If I had fallen immediately to the floor in the bathroom, shrieking in agony and terror, I wouldn't have gotten myself out of there.
How one woman saved herself from a deadly explosion.
Then, a lesson we should all take from scientific research.
If you are passionate about something, keep going, don't give up. Mistakes can and do happen, but it doesn't mean you're on the wrong path. It just means you're learning.
All that and more on Radio Health Journal. I'm Elizabeth Westfield, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
If anybody needed anything from the president, they put it in writing directly to her. She wrote back. She drafted public statements. She decided who saw him.
The first female president you've never heard of. Then,
you need to care about whether and when we might finally be able to see a full account of what our leaders have done in our name.
The daunting task of declassifying government secrets. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station, iTunes, and Stitcher.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.